The opinions expressed in the following programs are those of the participants and do not necessarily reflect those of Rogers Cable or Rogers TV.
Welcome to Georgina Connects, a show all about connecting you with the social services and organizations that support Georgina. I'm your host, Michael Gardiner-Davis, and joining me today as a co-host is Sandra Hanmar.
So great to be with you, Georgina. Have we got a terrific show for you, talking about something near and dear to everyone's heart, healthcare in Georgina.
We've got a lot of great information on today's show. Don't go anywhere. To set the scene, back in February of 2023, the Ontario provincial government created a new healthcare plan focused on creating a convenient and connected system. Titled Your Health Plan, this plan had three key pillars. 1, the right care in the right place. 2, faster access to care. And 3, hiring more healthcare workers. The Ontario government is relying on local Ontario health teams to help support these aims and bring them to fruition. To chat with us more about how that might be taking place in Georgina, we have the Executive Director of our local Ontario Health Team, Gail Seddon, here to explain some more. Gail, thank you so much for joining us today.
Thank you very much for inviting me. I'm thrilled to be here.
Of course. So could you start with maybe telling us about what an Ontario Health Team is?
For sure. So an Ontario Health Team is really about leveraging our local assets, working with the people who are being served to understand how we can make the system better for those who are being served, those who work in the system, and eventually, as Ontario health teams mature, they'll start to look at something called population health management, which is really the study of and making sure that resources and access to care is as close to home as possible, and using evidence-informed care and data to help to decide what needs to happen next, what's working well, and what needs to be altered so it can better serve the population.
That's incredible.
Gail, can you tell us a little bit about what our local health team is doing and what can we look forward to in Georgina?
For sure. So one of the things the Ontario Health Team in this area has been doing is, if you'll recall, during the COVID pandemic, everyone remembers that, it was our health team that helped provide vaccinations to the community. We ran a COVID cold and flu clinic right here in Georgina, so people who were having upper respiratory infections had rapid access to care. The other thing that we've been working with is there's a number of women who need to have what's called primary care screening for cancer, such as mammograms, such as pap smears. And so we've been working with local community ambassadors to reach out to those women who sometimes struggle to access care, perhaps because they don't understand where to get the screening done, perhaps because their housing's a little bit precarious, they're moving around, they're not getting some of the letters that other people with more permanent addresses are, but really reaching out to them. And in fact, over 3,000 of those women have been reached out, and we've been able to support them to get cancer screening. And what's really exciting and on our horizon is that we're going to have a integrated primary care team. And this is going to be a team that provides access to those people in this community who do not have access to primary care. We believe that there's roughly 3,000 people in this community that struggle to get access to primary care. And by primary care, I mean nurse practitioners, nurses, dietitians, occupational therapists, social workers, and of course, primary care physicians.
Wow, lots of great activities happening
going on for
sure. And we are going to come back a little later in the show to talk about the cancer ambassadors. We've actually got one who's going to join us, which is terrific. I want to talk a little bit about resources and human resources for our primary care. And you and I were chatting that government has just announced a new medical school for York Region, York University, particularly focusing on primary care. I know it's early days, but
Yeah.
what might be the impact that we can expect from that? And tell us about the model too.
Well, I think it's a really exciting model because this is a medical school that, as you've read in the press, is designed to train people to work in primary care. And isn't that exciting that it's in our community, that they're going to be supporting local people to get access to higher education, and most importantly, are going to be able to expand the primary care graduates, thus the primary care access in our community. You know, time will tell as this model unfolds, but as it's described right now, I think it's a really exciting, novel approach.
How about local trained individuals to stay within their community? Time will tell how that works and help with the manpower that we need.
Absolutely. Now, considering local, let's go back to maybe some of the gaps in Georgina healthcare that you're looking to tackle moving forward.
So I think the biggest gap we're looking at is really access to care closer to home. So one of those big pieces is around primary care. But when you think of an Ontario health team, it's really about pulling other partners together, because access for yourself may mean something very different for someone else.
Absolutely.
And I'll explain a little bit more what I mean. If you happen to own a car, access to care is a little bit of a different story. If you require using public transit, if you are struggling a little bit financially, even public transit can be difficult. So one of the things we're really looking at is understanding not only access to care for some, but access to care for all. And especially as you look across the world, the leading health centers, the leading health systems are really providing integrated care that is grounded in primary care and as close to home as possible. Of course, we're always going to need things like regional cancer centers, regional cardiac centers with that high level of expertise. But for those everyday chronic diseases, making sure people are getting their vaccines, good health education, we really want to get that close to home.
That's incredible. That sounds really great for the people of Georgina, and it looks like we have a lot of exciting things on our way in healthcare. You were mentioning about the IPC team.
Right.
So when can the folks of Georgina expect to see that come into action?
We are hoping to have that up by the fall. We're in a lot of planning activities right now. It is going to, we propose it being a multi-approach, that meaning that we'll be doing some outreach through virtual care, doing some outreach by going closer to people, and also having a clinic setting. Working through all of that right now.
Absolutely. So there's a lot of planning going on,
yes,
but a lot of good things on the way.
Yeah, and one of the things that's really exciting about that is many of, in fact, all of our partners have worked together before. So we know each other. They are people who have served the Georgina community for a long time, such as the nurse practitioner-led clinic. And so we're really leveraging those local assets, but coming together in a new and innovative way to bring the best what we all can contribute to provide greater access to care.
That is incredible.
It's amazing. It's amazing. And Gail, it's great that you're emphasizing that we're building on what's already here.
Yeah.
Because people know and are trusting what's here. They know they need more. So it's really exciting. Can you share with us what excites you the most about what the OHT can do? And conversely, what worries you the most?
Fair enough. I think what really, really excites me the most about what an OHT can do is the elevation of the voice that has not always been part of the health system and certainly not part of health system planning. The other piece of an OHT is that patient, caregivers, receivers of service, clients, however you wish to label those individuals, those who are served by the system, are actually partners in designing it. What is meaningful for me? What works for me? And there's a story about nothing about us without us, and really that's what the Ontario Health Team is doing. And in fact, if you look at our structure, we have a patient caregiver, and we purposely call it a partnership council because they are partners. The members of that council know that they are there to roll up their sleeves and actively be involved in all of our projects, both the design, the implementation, the evaluation, evaluation. So that's the piece that really, really excites me.
I love it. So lots of opportunity for Georgina to get services. More importantly, though, to be able to help shape the services.
Absolutely. To the second part of your question, I think one of the things that keeps me up at night is this is a new concept. And so the idea, as I mentioned, of integrated care is not new globally. We have amazing examples of where integrated care grounded in primary care has been very successful. How do we start to bring this new way of working into the Ontario healthcare landscape? If I may, historically, we've had requests for proposals where some organizations have had to compete, for example, with other organizations. Or in an Ontario Health Team, we're talking about collaborative governance. We're talking about working together. So it's just, it's not hard, but it is complex to make that change to how are we going to work together towards common goals.
Common goals. It's different.
Definitely
Great.
is. Absolutely. So I want to kind of put this into perspective for the folks of Georgina because they might not know what the NIS OHT is. Could you talk about some of the partner organizations that are involved in the OHT?
Absolutely. So I think the easiest way to answer that is anyone who provides social and healthcare services are members of the OHT. So for example, we have nearly 300 primary care, including the MPLC and the primary care physicians, actually the office just down the hall, to be honest. We have great partners like Roots, and we have CHATS, we have CMHA, and that's really just naming a few. But one of the things with an OHT is it's not a private club. It really is saying, how can we all work together? So for example, the Alzheimer's Society has been very, very involved in supporting us. The AIDS Society has been very involved looking at a bit more of a niche population, but still participating. And how we've organized ourselves is we've created network tables. So those who most commonly identify as home care providers or long-term care providers, they all sit at that network table. They elect a representative who sits on our more senior council. But what's important to this is it's not a top-down, it's a two-way communication. So those conversations that happen at those network tables are equally important as other conversations.
Exactly. So there's a lot of great stuff on the way. So where can the folks of Georgina go for more information?
They can go to our website, they can follow us on social media, and we also have town halls and community events that we welcome everyone to.
Thank you so much, Gail. We'll be right back after the break. Welcome back to Georgina Connects. To continue on our topic of healthcare in Georgina, we're joined by a couple of cancer awareness ambassadors from the Cancer Awareness Program, which is a collaboration between our local Ontario Health Team and Roots Connecting Communities. Joining us to chat about cancer awareness are two ambassadors, Jan Osborne and Maria Fernandez. Thank you both for joining us.
Thank you.
Of course. So could you tell us about what the Cancer Awareness Program is for starters?
Well, we are trying to get people to be tested early for colon cancer, cervical cancer, and breast cancer, and make sure that they're tested regularly. Because if you get cancer early, then you can usually cure it. Can I give you an example?
You can absolutely.
I was in a car accident down in Florida. I was out cold. So they took me to the hospital and they did a full CT scan on me, and they found in my lung a little wee 5 millimeter or centimeter, I guess, little wee one anyhow, spot on my lung. And so I came home and we watched it for a year. And then all of a sudden it started to grow. But because it was so small, had no symptoms whatsoever, but so small, they were able to take it out. And that was 7 years ago. And I've had no problem since.
Wow.
So if you get it early, and this is what we are promoting, get your testing early.
You never know if it might affect you. Like you're saying, you didn't even go in for screening. It was just kind of an
I had
accident.
no symptoms. No symptoms whatsoever. When it's that small, nothing.
Very good to get in there early. Maria, tell us a little bit about what you would tell people to get screened. Why is it important?
Like Jan said, if you get screened early, you can prevent cancer. And you can catch it at the beginning stage. There's many cures for cancer today. So if you can catch it early, that's the most important
That's
part.
a good thing. You two have been amazing ambassadors for us and raising awareness and really trying to encourage people to get screened early. What have been some of your most rewarding moments as you've done this? And then what have been some of the challenges?
Rewarding. I would say the youth one that we just did. We did presentation to the youth center in Sutton.
The Salvation Army shelter.
The Salvation Army one, yeah. And I went in there without much expectations, but my heavens, they just listened and commented, and a lot of them had relatives that had cancer, and some were found early, some weren't found early enough. So
Yeah, that was really amazing because we didn't expect that at all. And they were just absorbing all we were telling them, but we played a Jeopardy game, so we made it more exciting for them and interesting. And so they all participated, and I think they learned a lot from it. So I think that was very rewarding for us.
Good.
Yeah.
Absolutely.
And the challenges, sometimes when you try to talk to people about cancer, they don't want to hear. So right now I have a lady who's had breast cancer, has had a mastectomy. And every time I ask her, did you go for your screening? Because they still have to go. And she says, no. And every time I go to swimming, I see her and I say, did you go? Did you go? So I told her next time I'm going to send a message on her phone.
Take her with you. Take her with you.
Sometimes, for some people, that is something, if they want, we can help them with, do. And I think it's an important step. Because a lot of people are afraid.
What is the biggest barrier for people? What are you finding? Why don't people want to go?
They're just afraid to know, some people, because they know they have cancer in their families, so they're just afraid that they might have the thing. But you try to break it down. So, for example, a lot of people don't like to do the colon cancer. But now they have the new FIT test, which is much easier than what it was before.
What you used to have to do, for sure.
Before it had a couple of smears on a piece of
Absolutely.
Right.
But it's much, much easier now. So encouraging them that way, that it's not going to take a lot of time.
To do it. So let's role play a little bit. I'm somebody that you're trying to convince to go for screening. How do you do it? What do you say to me?
Just when did you last have breast? Let's have a mammography.
Do for mammograms. That's perfect.
Yeah, let's do a mammogram.
Perfect.
We're women. Yeah. When did you last have your mammogram?
2 years ago.
Oh, very good. Very good. So you're about due to do a new one then.
I am.
I think it's about every other year that they would like you to do it, especially. And did you start at about 50, which is.
I did.
We try and tell people that they have any symptoms whatsoever, don't wait till you're 50. That's no. But that's the general time
Rule
when
of
people
thumb right
start
now.
getting.
If you see signs, start early. There's
Exactly.
nothing wrong with that.
Exactly.
Absolutely.
Yeah.
Or if you have a family history,
That's
make sure you
important
go
too.
early.
Absolutely.
So it's
the
really
first
important
signs
for
come
people
on.
to know their family history.
That's right.
Some cancers still come out of the blue, so to speak, but it is a good idea to know your history and know then where you're going to go. Okay. What else would you say to me? I'm really scared. I really don't want to go.
Well, if you'd
how
like,
much are you gonna help
I'd
me?
come with you.
Perfect.
Wow.
That's really great.
That's
so I'd have
incredible.
somebody with me all along.
Yeah, and that makes a big difference for some people who are scared. So
100%.
You need help, we'll be there.
That would help me quite a bit.
So
Thank you.
for the folks that maybe they're scared, for the folks that maybe want to chat with you more, I'm just wondering, are people able to get you to come out to an organization or a group? How do they sort of get in contact with you to get this awareness, to get you to
Okay,
speak
so
to their
we
group?
are teaming together with Roots. So if anybody needs any help, they can call Roots, and they want to have want us to present at whatever function they have or anything like that. We're willing to come out. So this is an opportunity. Please reach out to Roots and ask for the cancer ambassadors, and we'll be willing to arrange a date to come out and do the screen.
So it seems like you've got the presentations, you have some engaging games. It seems like you can connect one-on-one. Is there anything you don't do? That's incredible.
We can't get people to ask us to come.
Right.
That's what we don't do yet, is we haven't figured out a real good way to get awareness, cancer awareness ambassador awareness of what we can do.
Trying to get those opportunities to come up whenever. So if people are interested in, getting Jan and Maria to come speak with their group, they know that they can reach out to the Roots office. I'm just wondering, what populations do you really like to focus on? Like, I understand that women is probably one of them, but what folks are you really trying to get a hold of?
Everyone.
Everyone.
You were talking about colon cancer being one, and it's not just a female
No, and it's
piece.
getting younger,
It's
too.
getting younger, which is scary.
Yeah.
Yeah.
So we're finding that even though the thing says the screening starts at around 50, but for cervical cancer a lot earlier. If today women have sex and, unprotected sex sometimes. So if they are active and they think something's wrong, start the cancer treatment. Go and get screened earlier.
right away.
Yeah.
Right.
You really
And there's some good news too that I'm sort of learning about. With the cervical cancer, a lot of women don't like pap smears, me included. But they've got a new one that they're testing out in BC, and it's an HPV, human papillomavirus is what they're testing for, which the pap smear shows what the HPV has done to your cervix. This one gets it much, much earlier, and they're expecting very good luck. And how it is it's sort of like the one we used to test for COVID, only in the other department there. And then you get it and you send it off and it gets tested. So you don't have to go to a doctor. You don't have to have that embarrassing position.
The cold speculum.
I think all women can understand what I'm saying there. I'm not sure the men can, but anyhow.
Probably not, but I've heard some almost horror stories. So it's nice to hear that they're making it a bit more accessible and a little bit easier to access, because that's the most important thing, right?
As I understand it, they're testing it in BC, and if it goes the way we're expecting, it'll be here in a couple of years.
Let's hope that happens then. Absolutely.
Because that will get it much, much, much earlier.
Yeah, absolutely. No, you seem like an absolute knowledge source for all things cancer, which is incredible. And that's really important for an ambassador, because if anyone has questions, they need someone to go to, right? The average person doesn't necessarily know as much as you two might.
Can I put in
course.
another little
Absolutely.
I drive for cancer. I've driven for cancer for over 20 years, where I've driven people to their radiation or their chemo, or sometimes just their doctor's appointments. And we do need more drivers. So if anybody has a half a day that they could give, if they contact, I think I'll let them contact Roots, or the Cancer Society is who they should contact.
Absolutely.
But we'll let them contact anybody if they're willing to be a driver, we'll train them.
Absolutely. And what does that kind of entail?
Well, you pick the person up, you take them to their appointment, you wait around so that then you bring them back.
Absolutely.
And for here in Georgina, you can say that you just want to drive to South Lake.
Right.
Most of my drives are South Lake because most people get treated in South Lake.
That makes sense.
But there are some that have to be treated in Sunnybrook or Princess Margaret.
A little further away.
If you don't want to drive for those, I'll do those. If you do the South Lake ones, I'll have time for those. Yes.
Absolutely.
Yeah.
What a wealth of information both of you are. And for the residents of Georgina, you can find out information about the importance of being screened. If you're nervous about going to an appointment, we've got 2 people that can go. Great connections with the Cancer Society as well to make sure you can get to your appointments. What else do we need to tell residents about what you do and how to get connected?
Well, one other thing I'd like to add is we also send out the doctors send out the letters, remind people to come for their appointments.
Right.
And it's very important when you get one to think about it and to try and make that appointment as soon as possible, because that's a reminder. Sometimes the reminder doesn't come again, but
It's a reminder. Well, I know in my own personal circumstance, I got one a year ago, and was told to make the appointment. I made the appointment 18 months.
Oh
so
my,
we've also got
it shouldn't be
there's a
that
challenge
long.
of access to mammography in certain spots.
Oh
but
my
that
gosh.
shouldn't be a deterrent for anyone at all.
Oh, no, it
Raise
shouldn't.
the awareness, do the testing
Yeah.
for sure.
So when it comes to finding out more information about what you 2 do and how people might be able to get involved or learn more, where can they go?
call Roots.
Roots again.
You
The
can
number
call
is
us, absolutely.
905-722.
4616.
46.
And they'll get you connected with you.
Yeah,
Thank you
now
so
there's
much for
cancer
watching.
ambassadors. and we're
From
here to
Roots,
help.
I would take personal calls if Roots tell me that, or I can
Thank
phone
you.
people if you give me
Perfect.
That's a
their
list of
number.
people.
Great. Thank you, Jan, and thank you so much for tuning in.